awesome today. So
Okay. Everybody ready? Okay, we don't have time for a tutorial on how to record.
Go ahead.
Okay, well, so first of all, we had seizure versus stroke. And there's no certain age range that strokes and seizures affect. Strokes are more commonly over the age of 55, but that's not a definite age range. It doesn't happen. They happen to people of all ages. But seizures occur when your brain receives too much stimuli, causing it to kind of shut down and reboot. And the symptoms include involuntary muscle spasms or convulsions, but they can also be asymptomatic. So we talked about empatho, the one where they just kind of like stare out into space and you have no idea what they're doing. They're just off in their own little world. Strokes occur when your brain is deprived of oxygen or blood flow due to blood clots or bleeding, so you can have ischemic or hemorrhagic. And some symptoms include facial drooping, one-arm weakness and numbness, along with slurred speech, and one can also be confused, nauseous, or off balance. So our case study, which I forgot to bring up here, is our case study back here? Is a 73-year-old man comes to the ER with right-sided weakness and an inability to talk. What do you do? So we said that we would start giving vitals, and we would begin a physical assessment. Then we would give blood-thinning drugs, like aspirin, to prevent another stroke if it's ischemic. If it's hemorrhagic, do not give blood thinners at all, because you will harm your patient.
Okay, so knowing that, the first thing they need to do is determine which type it is, right? What would be the best way for them to figure that out?
CAT scan. Yeah, CAT scan.
Say it to the
CAT scan. There's no CAT scan.
Okay.
But after doing that, a doctor would listen to the heart and listen for bruit over the carotid arteries, which we talked about that in lab. It's like that whooshing sound that you hear that can indicate a blockage. They may also use an ophthalmoscope to look for clots behind the eye. Blood tests for infection, blood sugar, and clotting factors would be done. We talked about a CAT scan, an MRI to detect brain tissue damage, carotid ultrasound, cerebral angiogram, and an echocardiogram. And by running all those tests, at this point you would know which kind of stroke it was, either ischemic or hemorrhagic. If it's ischemic, blood must be quickly restored to the brain, and you use IV drugs to kind of break up that clot. Hemorrhagic, you have to control the bleeding and reduce pressure and make sure you do not give aspirin or other blood thinners. And for our nursing diagnosis, we have that they're at risk for intracranial pressure, risk for depression, risk for seizures, and risk for aphasia. And then I'll show you our seizure versus stroke video real quick. Which room is this?
245.
A seizure or a stroke to the patient or the family is a clinical event. They're doing something. Most of the time in the case of a stroke, they're not doing something. They've lost vision. They've gotten numb on one side of their body. Stroke takes place when the blood supply to one part of the brain is interrupted in some fashion. It can be interrupted because a blood vessel closes off. It can be interrupted because a blood vessel breaks and there's hemorrhaging into the brain. But the net result is that there's some portion of tissue that's not getting its normal blood supply, and that's why it stops working. You get a loss of function. In the case of seizures, paradoxically, the clinical event is usually positive. They're shaking, or they feel something, or they see something. So the brain, rather than not working, is working excessively and abnormally. Large areas of the brain will all start firing off their electrical discharges all at the same time. Part of the way that we figure out where a seizure is located is by listening to the patient carefully, having them describe what their symptoms are, and that gives us an idea where it's starting from.
That
Okay, so if you think somebody was having a stroke, you might have them hold their hands out in front of them. Can you hold your hands out in front of you?
Not my right side.
Okay, so then one side would droop, and you would have them. Can you smile? Good.
You can't turn.
You know what? We might have to pretend that you're able to stand so they can sort of see
I
what
don't know
you're.
how to really like droop
Yeah.
my face. Like,
Okay.
is it my right side? That's weak.
Yeah, right side. He said right side weakness. It's kind of hard to do.
Yeah.
And can you stick your tongue out?
A little bit.
A little bit. Yeah.
So if he was going to stick his tongue out, what
It would
would
probably-
happen? It wouldn't be midline. It would
Yeah.
be kind of off
Yeah.
to one side.
And that's pretty
So
much
those-
what you
So you're testing for the facial weakness, motor strain.
They probably check for like responses to like pain and stimuli and
Right.
pinch it and
I didn't see whether you moved your right arm at all or if it was
Yeah.
if it wasn't moving at all.
Yeah, you'd be like, all right.
you wouldn't move it.
Yeah.
You could do this test, you
Yeah.
know, and it wouldn't be able to raise up. They might not be able to move the arm at all. So then you're going to say, okay, they don't have any motor strain. Do they have sensation? So you're going to check for sensation by doing some little bit of painful stimuli to see if they feel that, and if they do, you know, really tight. So just some real quick, brief tests that they can do in the situation that you would describe. The patient presenting with right side weakness. Okay. Can you post the link for your video?
I put the link in our little written thing that I
Okay.
emailed it to you.
Okay.
So.
All right. All right. Thank